Welcome to Mentoring Moment. I have a very special guest on set today, and I am already being educated by our special guest. And like you know, in Mentoring Moment, I tend to do these interviews just to leverage my relationship with my network and serve the greater community. Okay, so today is a very special day. I'm very excited because I have already been educated, and I'm sure you will be educated as well. So let's call on to this set. Hello and welcome to Mentoring Moment. Nice one. Now, I am very excited. First, briefly, tell us your name and what you do.
My name is Olayinka Egerton Shingle, and I am an osteopath and also an occupational health advisor.
Okay, all right. Now this is where I get excited. Now, what is the difference between an osteopath and a chiropractor? I have always, you know what? In my mind, I've always thought that people who do massages, people who are chiropractors, and also I thought they are all in the same game. And until you corrected me a few minutes ago. All right. So what is the difference?
Osteopaths and chiropractors have similar background in terms of medical based. However, it depends on what osteopath you go to, and it also depends on what chiropractor you go to. The aim is to reduce pain and improve movements of the spine, of the joints, so your shoulder joints, your knee joint, anything. However, the treatment style is different. So what we do is, if for example you come in with a neck pain, we have a look at your back, we have a look at the way you walk, we have a look at the way you sit, we have a look at everything that you do in your day-to-day life. And our treatment sessions tend to be 30 minutes to 45 minutes. However, judging from the chiropractors that I've observed, their treatment sessions is about 15 to 20 minutes. So I think osteopaths, we go and tend to look a lot deeper in terms of what could possibly be causing the pain and not just the symptoms.
Okay. So why have you chosen to work for yourself instead of working for the NHS? I mean,
there are some osteopaths in the NHS, but the truth is they can't afford us. I have worked in the NHS, but there's never enough funding for osteopaths. Physiotherapists are more mainstream, and we osteopaths believe that we need to spend at least 30 minutes with a patient before saying this is what we think is wrong and this is how we're going to treat. And more time equally means more money. So most osteopaths go privately.
I see. But even then, you have a business,
Yes.
okay? You have not, what's the name of your business?
Body language health.
Body language health. I like that. Now, you have not chosen to work for a private hospital. You've chosen to run a business, okay? Why have you chosen to run a business as opposed to working for a private organization? Why a business and not an employee?
Well, I do a bit of both. So I do work for a private clinic, but as a self-employed. But that's the way most private osteopathic clinics are run. It's on a self-employed basis, so you're not employed. You go in, you see your patients, and you treat them as your own patients.
So what kind of challenges do you? Because if you're working as a self-employed person, that means that, or you're running your own business, that means that you have to rely on getting your own clients. So what kind of challenges do you find trying to get your own clients, as opposed to working for the NHS or, again, like a private clinic as an employee, rather than a self-employed person?
To be honest, it's it has been mainly word of mouth. So in the past, I've tried to advertise with leaflets and flyers and things like that, but it didn't really work, because when I found I was doing that, people automatically think the first thing on your mind is money. But I want people to see my passion first. So most of my clients and most of my patients, it's it's been word of mouth. I treated someone else and they told their sister told their brother.
See Ola a week ago and she sorted me right out. I couldn't walk because this was all so tight, and a week later she's a miracle worker. 1 week and she sorted me out. I couldn't ask for more. Thank you, Ola.
It can be difficult when you're trying to explain something to someone about health, but you don't want them to feel like your main motive is money, because it's, for me, it's not. It's more about just trying to bring awareness to understanding your own body's language, which is where the name came from.
I'll come back to the body language thing in a minute. But for a career path, why did you choose this path?
It's all worked out in a funny way, but I think it's worked out for the best. When I was in school, I played a lot of sports. So I played basketball, tennis, netball, football, anything to do with sports, sprinting. And when someone got injured, I was always the first person on the scene, wanting to know what happened, how it happened, what was broken, what could be done. And at that stage, I wanted to be an accountant. Because my dad is, so that was what I knew. However, the teachers and the sports coach around me saw that, and they mentioned to me, "Why don't you be a physiotherapist? Why don't you find out more about it?" So I looked into it, and that was what I actually applied for, to go to uni. However, I was rejected by every university for physio.
Okay.
And at that point, I thought, maybe I'm not supposed to do this. So I looked into pharmacology because, you know, parents advised and said, okay, so why don't you do this? You like science, why don't you go into this? However, 4 weeks into my pharmacology course, we had to go and get our books, you know, to choose the books that we need to help us throughout the year. And in the bookstore, I walked past anatomy and physiology book, and I didn't leave. I actually stared at it. So the book was called A Trail Guide to the Human Body. And when I saw that book and I opened it, I said, this is what I want to do. And even though I was already 4 weeks into the course, I left the course and I went to find out more about physio, osteopathy, chiropractors. And when I did my research, I was drawn more into osteo. So I approached the university, explained to them exactly how I felt and why I felt that this was the course I was supposed to do, and I got accepted.
All right. Now, the name of your company, business, is Body Language Health. So it presupposes that our body talks to us.
Yes, exactly.
So tell me more about that.
So I think people forget that. So for example, let's take weight loss. Me trying to lose weight compared to someone else trying to lose weight, no matter what we do, if we eat the same type of food and exercise the same exact way, we will not lose weight at the same pace. So our genetic makeup is different. So what your body is telling you to do will not be what my body is telling me to do. So it's a case of, I could treat 2 people with neck pain. I could treat 1 person and they could improve after 2 sessions, and I have someone else that would improve after 1, or I have someone else that wouldn't get better until after 6. So it's also understanding what your body is capable of doing, and that also includes what you put your body through every day. So a builder or a plumber puts their body through something different every day compared to an IT consultant who's desk-based. So it's trying to get people to understand what your body is capable of doing based on your lifestyle. So everyone should not be treated the same way, or everyone should not receive the same exact advice. And that's what I mean by your body's language. So I could spend 5 hours bending at a tap, and the next day I would suffer because that's not my job. That's not what I do on a day to day. However, a plumber could do that, and the next day he's absolutely fine. So it's understanding what your body is telling you to do and knowing when to take a step back, or when to rest, or when to exercise, or
Wow. So how do we then train? How can I train myself then to, since my body has a voice? How can I train? So as a speaker and as a golfer, so how can I train myself to listen to my body?
The body always warns you. So if, for example, you start getting headaches, that's why I always say, when you are having the same pattern every day or every week. So if you're someone who's starting to get headaches every day on a Friday, that's your body warning you that there's something wrong. So you need to then have it's a case of having to then write down what you're doing every day and seeing at what point your body is telling you to do something. So you getting headaches is probably your body telling you either need more water, or stress, or the lighting is not right, or you're not having enough of a particular type of food. So it's learning to listen. So if you sit there for 20 minutes and you start to get an ache in your back, that's your body telling you to get up. So it's those type of signs that you need to look out for. So it's not a case of sitting there, you've got back pain, and you're like, and carry on. So that way you're not in tune, and you're taking advantage of what your body is capable of doing, rather than allowing it to have the rest when it needs to.
So what advice would you give anyone right now who has, could be ankle pain, wrist pain, or whatever kind of pain? What advice will you give? If someone starts having pain regularly, what advice will you give the person?
Well, again, it depends on the type of pain. So that's when a consultation comes in. So when someone comes to see me, I sit them down and I ask them about their past history. So if someone has ankle pain, it's a case of, what were you doing before? What are you doing now? And is it something that you can change? So it's trying to find out what that particular person does, and it's then a case of trying to see if they are open to treatment. So it's not just medication, because medication can just mask the pain. It doesn't get to the roots of it. So it's trying to find out if they are open to finding out what else they can do and what it is that they're doing in their everyday life, because there's always something that you've done in the past or you're doing that would bring on pain.
So that's like an alternative medicine as well?
Yes.
Okay. Wow. So what advice will you give someone who is looking into starting a practice? Because that's what you run. You run a practice. So what advice will you give to anyone who is looking into going into your line of work, being an osteopath, right?
Osteopath,
okay,
yes.
So what advice will you give them?
My advice mainly would be, to be an osteopath, you need passion. If it's you can attract people because of skill, but the reason people stay and keep coming back to you is because they see your passion, and it's important to keep that passion going, because osteopathy, when you start off, it's not easy, because it's kind of like you're trying to convince people that you're good enough for them to trust you with their body. And when you show, or when you explain to them the reason why they need the treatment, and you explain to them the benefits that they get from it, then it always works out in the best way, usually. But my advice would be to let people see your passion for the reason why you're doing what you do, because without that, it's going to be a struggle.
So do you think as a nation, do you think we do enough in promoting preventive medicine?
The UK is starting to invest more in that now, because I also assess people's workstation. So I go to different offices and assess why someone is having a back pain and see the reason in their day-to-day life, because most people spend the amount of time at work. I think the occupational health field is starting to grow a lot more now, because people are seeing that it's better to prevent these joint problems rather than allowing people to go off sick from work. You know, so many people, thousands of people are signed off sick for back pain or repetitive strain, so constant typing and using the mouse. So what we do is we go into the workplace and we try and adjust their workstation so that there's less chances of them having back pain, leading to less chances of people calling in sick and saying, oh, I've got back pain, and then less chances of money being lost, because if someone calls in sick, you're still paying, or if you have to replace them, you're paying. So it's trying to make that a mainstream now, and I think UK are starting to invest a lot more in that now.
So those kind of corporate clients, for you, who will get them? Do you go out to get them yourself, or do the private clinics get them for you?
It's a mixture.
Okay.
So I work for another company called Royal British Legion. It's an organization, and they get the customers, and then we go out and assess.
I see. Well, well, thank you so much for coming in today. I have really been educated, because I couldn't tell the difference between physiotherapy, osteopath, and a chiropractor. I just thought somewhere in there they just do the same thing, but they just tend to bill us differently. You know, use a very big grammar to take money off. And I will try and make a practice of listening to my body. Like, I thank you so much for coming to Mentoring Moments, and really appreciate your time.
Thank you.
All right.
Thank you.